Hello, everyone. This is Farah Al-Shami. I'm a senior fellow at the Arab Reform Initiative and the director of ARI's Social Protection Program. We're gonna give people some time to join in before we get started. Hello, everyone. Just for those of you who just joined, I was saying that we're gonna give our participants more time to join before we can get started. I can already see many of you in. But we'll give people a couple of more minutes. Okay. Okay, so let's get started. So hello, everyone. My name is Farah Al-Shami. I'm a senior fellow at the Arab Reform Initiative, ARI, and I also am the director of ARI's Social Protection Program. Welcome to today's webinar, which is a parallel to the UNCSW currently happening this week in New York. And this event is titled Unlocking Gender Equality, the Power of Universal Social Security Programs. And it is a conjunction. It's organized in partnership between the Global Campaign for the Right to Social Security that constitutes of so many great organizations, including Human Rights Watch, Amnesty, the ITUC, and the other basically organizations that I'm going to be enumerating now. This event is in partnership between the Global Campaign, but also ACT Church of Sweden, Action Against Hunger in France, Action Aid, and the Arab Reform Initiative, where I work. So thank you very much for joining us. The topic of social protection is often under discussed in high level policy and political events such as the CSW. And when it is discussed, usually or generally, it is less often discussed as from a gender perspective, although it is a very gendered space. Looking at social protection policies and programs, especially in the global south, but also in the world more broadly. So here comes the importance of today's session. We need to see that the flaws and deficiencies in our social protection systems aren't only affecting vulnerable groups and poor populations in general, but one of the key and the most vulnerable communities and populations that are affected are particularly women. Because women are they suffer from both explicit forms of discrimination and implicit forms of discrimination, which makes them in the baseline more susceptible to shocks, to crises, to loss of livelihoods, and to other life risks. And because women increase their families' welfare, as studies have shown, and therefore are the gender who benefit the most from social services and social policies and social protection programs and interventions in particular. We have very distinguished speakers with us today. We have Ana Maria Munoz Boudet, who's the lead economist at the gender group at the World Bank. We have Jane Aniagno, sorry if I'm pronouncing your names wrongly, who's the founder and director of Polycom Development Project and is based in Kenya. We have Tara Korti, researcher at ChristianAid based in India, and Abiodun Abaniyo, who's the head of department of food security and livelihoods program at Action Against Hunger in Nigeria. And we were supposed to have yet a fifth speaker, who is Ms. Shahra Razavi, who's the director of Universal Social Protection Department at the ILO, but unfortunately she had to cancel her participation due to other last minute work engagements. So therefore, I'm gonna try to put things into perspective and set the stage for the rest of the discussion today, covering what Ms. Ravazi was mostly going to tap into, which is basically the framework of social protection and the concept of social protection. So social protection is basically a tool to prevent and to protect people from the loss of livelihoods and to provide them with minimum wage or minimum income security and protect them from life cycle risks as well as life risks, to protect the elderly, children, and to protect as well people with disabilities, people who are unemployed, so that those who cannot work or those who are not of working age as well are also guaranteed minimum income security. Social protection, as per the ILO's definition in Convention 102 and Recommendation 202, is basically constitutes of a pyramid, if I am to describe it. It constitutes of supposedly a social protection floor, which comprises a universal health coverage for everyone, of course, and at the same time social grants to protect people across the life cycle and from life risks like unemployment and disability and sickness. And then comes the second layer of protection, knowing that the first layer, which is the floor, is supposed to be in large part, non-contributory, so that people who cannot afford the contributions can benefit from this protection. Then comes in the second layer in the pyramid, which is the insurance, health insurance, unemployment insurance, all kinds of insurance, which can be in large part contributory, but can as well be non-contributory. And this is to provide an extra layer of protection. And at the very top of the pyramid comes voluntary insurance for the people who need the extra protection and can afford it. And this should with the state and in coordination with the other programs. This is how a universal, integrated, inclusive, sustainable, and effective social protection system looks like, providing adequate protection to all citizens and residents with no exception. However, if we look at the countries of the Global South, we see that the status quo is very different. We see that the definition of social protection is being limited and restricted to very small scale poverty targeted programs, and even large scale ones, but even the largest scale poverty targeted programs cannot cover the national level because they remain programs that are limited in scope, that are transient, that are largely inadequate in the sense of the benefits and the transfers, the income transfers that they provide, and that are also ineffective and often reactive and conceived in reaction to a certain crisis. So poverty-targeted programs, poverty-targeted safety nets and cash transfers have become the most popular forms of supposedly of social protection programs, but they do not provide social security. These are just forms of social assistance, and they are targeted, which means that they do not follow a human rights-based perspective. To target poor populations and vulnerable populations, they follow, they adopt social registries and follow targeting methods such as mixed means testing and proxy means testing. And these targeting methods are very, they're full of flaws, basically. And this is what the evidence has shown, because social registries to begin with are very expensive to conduct and are fundamentally against the concept, the human rights-based approach to social protection, which is universal and therefore should follow a single registry instead of a social registry. In addition, they are very expensive to conduct, and they do not really capture the realities of the people in the registry due to biases and to misobservations. And at the same time, the means testing in general, whether be it mixed means testing or proxy means testing, has also been proven in the research to entail a very large margin of errors. And this margin of error is twofold. There is false inclusion, which means that you're including people that are not deserving, that do not deserve, and there is the basically exclusion of many people who deserve it. And often the people who are excluded are poor, and specifically the poorest. So the poorest are usually the most excluded. Poverty-targeted programs in general are scattered, sporadic, and not integrated. They're wasting development money on these transient, basically, interventions instead of using those to build infrastructures and to progressively realize the universal social protection systems that we aim for. So they are basically hindering or slowing the progressive realization of these systems by making the state look good and by basically providing some form of anesthesia to the people who need protection, causing also social inertia. So this has been the status quo, basically. We are providing social protection through these premises instead of establishing universal schemes and providing this protection to everyone in a more adequate, sustainable, and long-sighted way. The ILO has recently come up with a human rights-based social assistance framework to also define where the poverty-targeted programs should fall and where the humanitarian assistance should as well fall. Because poverty-targeted programs and humanitarian assistance have a role to play, but not to replace universal systems. They are to complement universal systems in times of crises, in times of shocks, in times of emergencies, basically, and of conflict. But what they are doing is that they are replacing those universal schemes, and this is because basically the approach is a poverty alleviation approach instead of a human rights-based approach, which allows for poverty eradication. And this is fundamentally due to the neoliberal systems that we live in, but at the same time, the projection of these systems and the impact of international financial institutions on national levels, making our governments who operate in very complex political economic structures favor this approach over any human rights-based approach because they want to exert their clientelism and their basically survival mechanisms. I hope I have covered some of the points that Shahra would have raised, speaking from ILO's perspective and providing the audience with a crash course about what universal social protection is and how it should be seen. At the same time, universal social protection is key to achieving gender justice. And we have very distinguished speakers with us, which I'm going to be presenting very briefly now before delving deeper into their bios and handing over to them. But any social policy and economic policy affects impacted communities the most. And because women, as mentioned before, due to explicit and implicit forms of discrimination, are more vulnerable and more susceptible relatively, then they are the most impacted. So the lack of equitable social policy and of decent social protection basically affects women disproportionately. And women are one of the most impacted by the lack of such systems. We have with us, I think I had already listed the speakers. Sorry, I'm a bit tired today, but our very first speaker has just also joined us. So, Miss Anna, thank you for joining us. I'm gonna be reading out your full bio this time, and then hand over to you to enlighten us more about the gender dimension of social protection. Miss Ana Maria Munoz Boudet, you're a lead economist with the gender group at the World Bank. You previously you were part of the Poverty and Equity Global Practice department, and you co-led the Mind, Behavior and Development Unit. You have over 15 years of experience across world regions, leading analytical and policy work on poverty, gender, and equity. You hold graduate degrees from the London School of Economics and the University College of London. I'm sure, Anna, you have a lot to tell us about this issue, and particularly when it comes to the role of social protection in promoting gender equality, the risks of exclusion and discrimination that may arise from complex selection processes, and also the gender perspective on social benefits that are provided to individuals or to households. The floor is yours, and you've got 7 to 8 minutes.
Thank you. And thank you for inviting me to speak today. I'm not sure I have a lot to say on top of all what you've already said, but I think a couple of things. So from the World Bank, last 2002, the World Bank launched the Social Protection Compass, which is the new vision of the bank towards social protection. And the Compass basically prioritizes the idea of universal social protection, particularly with 3 goals: increasing resilience by providing insurance against and building the capacity of households and individuals to manage shocks; opportunity to invest in human capital to help women and men access productive work; and equity, reducing poverty and inequality, promoting equality of opportunity, and addressing exclusion. So universal social protection is already part of this agenda on resilience, equity, and opportunity for all that the bank, from their social protection side, is already starting. On the gender side, we're also working on our new gender strategy, 2024-2030, and the gender strategy has as one of its main goals to protect investments in human capital for women, together with eliminating gender-based violence, promoting women as leaders, and others. We are aware that to date, social protection, whether targeted, PMT, universal, it has a lot of room for improvement, okay? A lot of it depends on available data on households and individuals. And yes, it's right, you're right. The norm is household level information, whether through social registries, whether through household surveys, whether through other means. But for the most part, even if we were to have data at the individual level, this information is never perfect, it's largely limited, and is more limited in countries where overall this data is lacking, even if we were to go for administrative data to identify the people, right? In Africa, studies have shown over and over that poverty measures or other deprivation measures at the household level obscure difference within the household, but even when we try to collect individual level data, this data is not available, right? A few examples, whether Brown and others, have taken up this issue and have tried to collect information, and there are now mechanisms to identify some deprivations, malnourishment, access to jobs, and others. And while social protection has expanded significantly, it's still, and I will make a case here, it misses the middle more than it misses the bottom. It misses most of whom are in the informal sector, which a large share of those are women. They're 95% to 90% of the women in South Asia or Sub-Saharan Africa are in the informal sector. And this is very clear during the COVID-19 pandemic. So it's the lower middle, and particularly the ones that are more vulnerable to falling back into poverty, who are less protected, women in the informal economy, and others. So ensuring coverage for this type of workers and the ones that are not working today and for the future, including pensions, it is important because it will help supporting then the resilience to shocks. So that is one where we need to cover gender gaps. The second is that there are several variations in outcomes at the country level, and social protection schemes are faced with competing sectoral priorities, particularly in the light of reduced budgets. So one of the things that the Social Protection Compass, and we're making the case from the gender strategy, is to promote better implementation capacity and efficiencies in spending. So whether implementers don't have to navigate difficult trade-offs, where they don't have to decide where to focus on, but we're also where we can see savings in the existing budgets by simplifying process and procedures. So take, for example, now we're working in Chile in the automatic process of the Universal Child Benefit Grant that before required applications. Now it's basically being given automatically to a set of households without needing even to apply for renewal. That actually helps the household, but also helps to protect the human capital of those children. And it reduces the time burden on women in particular to have to go to the service to apply, to bring the documents and others. So the delivery chain, which gets a lot less attention, is extremely gendered. The outreach, the way women are reached, how particularly groups of women that may be traditionally marginalized are reached, how the grievances mechanism happens, and others. What are the avenues to redress? So those are improvements that need to happen within the existing systems, even if we're not going for a full overhaul, and even if there are limitations for a full overhaul. The other 2 points. First is that one of the key pillars to ensure that women and girls get access to social protection, irrespective of the form, is addressing gender gaps in identification. It is the precondition to accessing safety nets and other services, and as many as 45% of women in low-income countries do not have access to any foundational ID in Sub-Saharan Africa and Southeast Asia. So, and there are many policy barriers that make this difficult. There are formal institutional barriers, whether it is you have to be here with your husband or you need to have a male guardian. However, ICT technologies and others can actually help and maybe cover for the lack of agency or the compounded gaps that women face to get IDs. So ensuring the inclusion of women with all backgrounds into ID system and addressing the barriers can actually help us reduce inequity. The other 2 are extending the notion of social protection to the full life cycle. So from protections in the early years, from protections of human capital to parental leave and pensions. So tackling not only the pension gap, but the care support gap, the support for the labor market, and others was actually important. And I had a 1.5 minute left, so I will leave it at that. But basically, we need to think about how do we introduce a system that progresses over the years. And yes, some of it might be targeted, some of it might proximity mean tested, and some of it might be universal. It's the compound resilience that we need to build that matters.
Yes, thank you very much for this. Indeed, the missing middle is what I indeed forgot, because in addition to the poorest of the poor, the missing middle is also excluded from proxy means testing. And to clarify to the audience, the missing middle is basically the informal middle class. So they're neither very poor to be targeted, and they're not rich enough to be informal, and yet not needy of social protection systems. Although from a human rights-based perspective, social protection should be provided to everyone, rich and poor, because it is everyone's right. And just to add that Development Pathways and ACT Church of Sweden have also released a couple of studies recently. I think one of them is included here in the chat, and they show that it's very unlikely for poverty target programs to be turned into more universal schemes in the future. So this is part of why we think of them as a tool that slows down basically the progressive realization of universality. And they also show that in many contexts in the global south, in 50+ countries, they could basically establish universal social protection schemes, which means that this is possible, and that the same amounts of money that are spent on these poverty targeted programs can be spent on more universal allowances and social grants. In addition, they entail a lot of like problems like data privacy issues, like looking at the household as the unit of observation as if it's homogeneous, and it's not homogeneous. So this way they disregard the specific needs of women and of girls. Thank you so much, Anna. I just wanted to add these couple of ideas to your great intervention, and we'll hear more from you during the discussion. Let's move now to more national contexts and case studies. We have Ms. Jane Anyago Odongo, who's a Kenyan activist for peace and for women's and girls' rights, and has more than 20 years of experience working with urban poor communities. She's the founder and director of the Polycom Development Project, which empowers girls and young women in the Kibera slum area with the mission to amplify their voices. The project focuses on topics such as hygiene, climate change, cohesion, grassroots organizing, among others. Jane, you have a lot to tell us from the Kenyan experience, and especially about the realities of girls and women on the ground. You're the kind of activists who can amplify their voices, who can amplify their keen need or dire need to access various services that they are deprived from. The data, especially the numbers, do not capture the realities of vulnerable groups. It is the storytelling and the lived experiences that you deal with that can really show us what they are suffering from and what is exactly that they need. Please, the floor is yours, and you've got 7 to 8 minutes as well.
Yeah, thank you so much, Farah, and everyone for this opportunity to share. First, as you've heard, I am from the slum settlement of Kibera. And I will just want to start by talking about myself. So what happens is that I started my work in my early 20s. And when I started my work, I started just as a grassroots woman responding to an issue in her community. I've worked all this time, mostly it's no funding. It's always about volunteering, and now I'm just in that stage where I've been able to look at myself and ask myself, how do I want to organize my life going forward? Sorry, there's some noise next to me, but it's okay.
We can hear you.
You can hear me, yes. So I've been in that stage where I'm asking myself, I've worked all this time. I'm supposed to, where do I want to take my life to? Most activists do their work, and at the end of the day, they retire in poverty and are very miserable. At the end of the day, many people don't even want to, become activists, because you give so much, you give your energy, you give your life, and there's no social protection. There's no one taking care of you. And, even the earnings, it's very hard to really get the salary that you're supposed to be getting. So I've really been thinking about retirement. And why am I retiring? I'm 50. So my question is, do I really want to wait until I die working, and then, or maybe I'm retired because of my age and just become miserable in the community? So there are so many people like me who have very just languishing in poverty right now. And as you mentioned before, we are like, it's the whatever social protection services that are there, programs that are there, are looking more into, can I say, poverty, responding to poverty, or just, supplementing what the government feels they should have. In Kenya, we have this, the money that is given to our old people. We have this, the monthly allowance that is given to them, which is really inadequate, and it's very little. And that is all that they think that is enough. We have the can I say, orphans who are also getting money, but this is also very, very inadequate. It's not for everyone, and it also doesn't come monthly. So people are really stressed. Everyone is stressed. If you start looking into the future, you are very stressed. People are living one day at a time because there's no hope, there's no plan. And what is very sad is that people are not even aware that there's something that the government can do. There's something that the global community can do. They don't understand that this is their fundamental right. that they are supposed to demand for services, they're supposed to demand for their security, their peace of mind from governments and different duty bearers. So it's such a tough situation. I'm not just talking about Kenya. I know most grassroots members of the grassroots community, it's people without job security, people who are like, it's even harder and they're still young. What if they get old and now they want to be, they need care, and the people who are supposed to be taking care of them are walking out there trying to look for jobs. So I think it's a huge call right now to everyone. And as we are talking about the upcoming summit for the future, what do we really want to say? If individuals, I am an individual, I'm already seeing my need, I'm already seeing my frustration, I'm already seeing, I am aware of what I should have, but I don't know how to pursue it. You talk to the like in Kenya, we have a lot of debts already. We have a lot of the economic situation is really tough for everyone. And then you ask yourself, what is going to happen tomorrow? So I think as we are talking, let us get as many people as possible to become aware that there's a need, to become aware that if we are talking about the future, if we are talking about fundamental rights, it's very important for the people to know what they are asking for so that they are able to claim. At times it's beyond your hands, it's beyond what you can do. But if you are talking to the right people, then maybe, there's hope, even if there's nothing material. So I want to leave it at that as at now, but I'm really excited to be part of this conversation. I'm excited to mobilize as many local people as possible to be part of this campaign, because if we don't talk, if we don't really understand the real situation on the ground, then I don't think we are going to move much. I know we have a lot of research out there, but now the people are empowered. Apart from research, we can get reality. And that is why I'm part of these conversations, because I bring reality, I connect reality with the research, the real situation on the ground. Otherwise,
Indeed.
thank you so much.
Indeed, and thank you so much. And because of what you last said, it's very relieving and validating to see that what you said is compatible with our research findings, basically. So thank you so much for this, Jane. And let's move to our third speaker, who's Dr. Tara Kurti. She's a researcher with Christian Aid and is based in India. She has a PhD in social work from the Tata Institute of Social Sciences in Mumbai. She has worked on research projects on gender-based violence, social protection in fragile contexts, gender-just macroeconomic policies, and anti-racist practices. She has provided advisory support to research projects in Africa, Asia, Latin America, and the Caribbean. Tara, you can definitely tell us a lot about the risk factors affecting social protection needs and the delivery of social protection services, particularly at the intersection with natural disasters, with climate change, with conflict, with displacement, and with many manifestations of the crises that we are facing currently in the global south. We are really looking forward to hear from you, and the floor is yours.
Thank you, Farah. I would like to start by remembering the iconic writer Toni Morrison. Toni Morrison spoke about the power of the margins when it came to positioning her writing. She said, "I stood at the border, claimed it as central, and the rest of the world moved to where I was." Today, I'll be speaking based on 2 research projects which tried to centralize the community voices in fragile and conflict-prone areas of Ethiopia, Burkina Faso, and Haiti. And today, I speak with hope in my heart, hoping that these community voices will reach a wider audience, will reach the rest of the world, as Toni Morrison reminds us. Yeah. When we look at the risk factors which affect social protection needs and the delivery of social protection services in fragile and conflict-prone areas, what our research shows is that the risk factors, some of the key risk factors are natural disasters, climate change, conflict, and displacement. When we look at the case of Haiti, what we see here is that Haiti is prone to natural hazards which lead to displacement, which has been noted by many academic articles. Misogynistic norms already place gendered communities at risk, and the instability caused by natural disasters increases the vulnerability faced by women. In fact, feminist scholars have noted that the domestic sphere in Haiti often revolves around mothers, and the mothers face a lot of violence when they're trying to fulfill their caregiving responsibilities. So, when women are trying to meet the survival needs of the families, especially after an episode of disaster, it is very challenging and the vulnerabilities are manifold. When we look at the agropastoralist communities in Ethiopia, our research shows that climate change is undermining food security. And what we see is climate change is leading to land degradation, it is leading to droughts and floods, conflict, and food insecurity. In fact, our key informants said that during normal times, the agropastoralists and the pastoralist families eat 2 meals in a day. When there is scarcity of food, women try to buffer the impact through strategies such as reducing their own consumption so that the male members of the family and the children have food to eat. So women are they themselves are putting their own well-being at risk because they're thinking about the family at large. In Ethiopia, we see that there is the Productive Safety Net program, which is a social protection program that supports food insecure households. However, the research site, which is the South Ari Warita or the district, is not classified as being eligible for the Productive Safety Net program because the program does not recognize South Ari as a chronically food insecure region. However, the community voices from the agropastoralist and the pastoralist communities in South Ari bring to the point that many households in this region are extremely food insecure and they do not benefit from the Productive Safety Net program because the criteria doesn't allow this particular district to come in its purview. What we also see with respect to conflict and violence, and I would like to speak a little bit about Haiti. What we see in Haiti is that Haiti is experiencing continuous political instability and transition for several years, which makes it challenging for its government to complete their social protection mandates. My esteemed colleague Anna mentioned about the importance of data. And in Haiti, we see that the national census could not be carried out due to the security situation. And according to various specialists in Haiti, the lack of up-to-date socio-demographic data gives rise to development budgets and plans that do not reflect the country's reality. In fact, Haiti does not even have the national database on GBV or gender-based violence. I would like to share a quote by a leader of a women's collective in Burkina Faso, where she explained to us what the conflict situation in Burkina Faso, how it affects the women. She shared with us that the state is focused on security and women who are internally displaced due to the conflict situation are more vulnerable to gender-based violence. And she said that women petty traders do not find a clientele easily as the conflict situation has made many households more precarious economically and hence their purchasing ability is low. The main focus of many households is to be food secure, as they know that the situation is uncertain. My last point is regarding the gendered constraints in accessing social protection. Our research with the agropastoralists in Ethiopia shows that women find it quite challenging to access health services. Women shared that they do not have adequate information, they do not have control over household income, and they need permission from husband to access the health services. The Kabils in this region, Kabils are the villages, are scattered and women have to usually travel long distances to access health services. So the point we are saying is there may be a health service available, but there are these gendered constraints which make it difficult for women to benefit from these social protection mechanisms. And in the pastoralist and agropastoralist communities in Ethiopia, we see that there are social norms which make women vulnerable to GBV, and there is the practice of early marriages. And there are various other practices which put women at risk and at certain disadvantage. And what we are seeing is women are becoming vulnerable to multidimensional poverty. And this is a key concern when we look at human rights, when we look at protecting the well-being of women. In the Haiti context, what we see that there are intersecting vulnerabilities which make it difficult for GBV survivors to access social protection services. For example, a GBV survivor from a displaced group is usually in a economically precarious condition. A GBV survivor from a displaced group may not have the know-how of how to access the medical care system and the justice seeking system in a host community, which is unfamiliar to the GBV survivor. With respect to GBV survivors from LGBTQI groups, what we see is they face additional barriers when they're trying to access social protection services such as medical care. GBV survivors from LGBTQI groups in our research reported that sometimes doctors with a Protestant religious identity may show reluctance to provide services to members from LGBTQI groups. So the point which our research is making that, the scholarship on social protection and gender dynamics recognizes that the context within which social protection is implemented, the social norms, the gender dynamics, and the other social dynamics are very important to consider in the design and implementation of social protection interventions. And our research is also supporting this particular insight that we need to be more careful about the context where interventions are being implemented and the dynamics happening in the context.
Thank you for this very insightful presentation, and it's very important that it's brought the sociological aspect of the issue, because indeed social power, gender dynamics are a key player here, and they're important for both the design and as outcome elements to be studied. So thank you so much for this, Tara, and we'll hear more from you and what's coming. About the opportunities and what you think could be done better. Let's move to our fourth speaker, who is Mr. Abiodun Abaniwo. It feels so good, by the way, to have a man on this panel today. So thank you for the solidarity. You're the head of food security and livelihoods and the social protection focal point at Action Against Hunger in Nigeria. You're responsible for Action Against Hunger Nigeria's mission, wide technical oversight, and for the strategic direction of its food security, livelihoods, climate change, disaster risk management, and reduction, as well as social protection programs. You are involved in a program called the Child Development Grant, and we know that you're very proud of it, which offered women cash transfers and change coaching sessions, including advice on nutrition, education, and care practices during the 1,000-day window of the grant. And this experience serves as inspiration for improvement in the social protection programs scheme. We'd like to hear more from you about the situation in Nigeria and about this program that I just mentioned and how it affected pregnant and lactating women, so that we can see how it is possible to conceive programs that are gender aware, sensitive, responsive, and transformative, and that this is possible even in the global South countries. The floor is yours, Abiodun.
Thank you very much, and good afternoon from Nigeria. The Nigeria situation is not quite different from what we have in other sub-Saharan Africa and some part of Asia. Nigeria has had its fair share of insecurity and conflicts in the northeast that started sometimes in 2009, and in recent years in the northwest, the issue of the banditry, farmers elders clash, in the north central, communal clashes, and the competition between farmers and elders, and also coming down to the south, the issue of abduction, kidnapping, community attacks, leading to displacement of people both in the north and in the south. For instance, in Benue State, there are almost as many IDPs in Benue State as it is in Borno. These are situations that are peculiar to Nigeria, in terms of insecurity. This is also coupled with, of course, climate change, flooding and droughts here and there. Farmers not able to access their farmland due to fear of attacks and reprisal attacks, leading to low production of food and limiting purchasing power of people from accessing the market for basic items. And on recent times, of course, the issue of the fuel subsidy removal, which lead to aggravated inflation in Nigeria, is really really a thing of concern, which has affected virtually everybody in Nigeria, with the inflation rates as of January being 29.9%, and for the past 10 months, there has been more than 1% increase in the inflation rate in Nigeria. These are peculiar issues, and of course, the issue of malnutrition in Nigeria, underweight, stunting, and things like that related to of course, that is more common with displaced population, and women, of course, suffering more GBV related attacks. The system not able to assist in either preventing the issue of the GBV or addressing them as it should. Gender inequality is also a norm in Nigeria, and so many other things. Early marriages, especially for girls in the north, usually girls below the age of 14, 13 are already married off, and very little, very, very few girls in northern Nigeria are able to access secondary and tertiary education. These are the dynamics in the Nigeria generally. The social protection system in Nigeria is quite more of a social assistance because of the rate of poverty. Of course, 80% of Nigerians are said to be multidimensionally poor. So in 2015, the launch for the social assistance began in Nigeria through advocacies and influencing from various actors and international partners and the UN agencies and the World Bank also supporting the initiatives. This also was, of course, it's also poverty targeted with just a little over 60 million households currently in the social register. But of course, not up to 20% have been mined for any form of assistance. So it is not just enough to be in the register and not getting the intervention, as it were. Also, we have some form of social security like the universal health coverage, so to say, but which is not really universal because it is a contributory health coverage. I remember during the Obasanjo era, the NHIS, which has been reformed several times, but which are not covering the informal sectors or not even integrating the very poor and vulnerable within the society. So women and girls suffer who are in poverty are not able to access basic healthcare services, basic antenatal and postnatal care services. Health facilities are not functional in many of the local or rural areas, and where they are functional, there are limited staff or no staff at all. There are no drugs, there are no RTF, there are nothing to treat malnutrition. So these are the various dynamics that in Nigeria. Of course, there's also corruption in the system in terms of the social assistance being rendered, which has made the present administration suspend that scheme for now. Of course, with so many people now below the poverty line, with so many people suffering from the aggravated inflation. So these are the general design. I'll quickly talk about the CDGP program. So it's a program we implemented for many years, where we support women with nutrition education, cash plus for nutrition outcomes, to access basic, to be able to afford some basic micronutrients in the community, and which it was able to. I'll talk later more about how the government later transitioned and our funding this initiative moving forward. Thank you very much.
Thank you so very much. I'm conscious of time, and I also realized that I didn't introduce the conversational tool that we are adopting in today's webinar. We are adopting the AHA conversational tool, which is anger, hope, and action. So the first round of interventions that you've seen is basically the anger segment of our discussion today. And it's basically meant to portray and describe the status quo and see where are the flaws, the deficiencies, the problems that women, girls, and the populations more generally are suffering from. But now let's move to a more positive segment, which is the hope segment. And in the hope segment, we intend to talk more about the opportunities. There are definitely opportunities for reform, for rectification, for improvement. And we want to hear more from all of you about this. Let's begin with let's do the same order basically, and start by hearing more from Anna about the room for improvement that exists and how we can basically leverage that and make it feasible. Anna, the floor is yours, and if you can keep it to 5 minutes, we would really appreciate it, so that we can talk more in the action part.
That's fine. So just as I mentioned at the beginning, we have the World Bank Social Protection Compass has 5 areas of focus. So the first one is building strong foundational social protection systems. The second one is addressing the coverage gaps to promote greater inclusion. The third one is addressing the flexibility gap to build more resilient and more adaptive and dynamic social protection. The fourth is the opportunity gap to scale up more effective programs. And the final one is to address the fiscal gap, which is to create more space in the more fiscal space for this. And the fiscal space is extremely relevant because, as we mentioned, basically national spending is not increasing and inefficient spending should be reduced. Operationally, what we're trying to do is to, from the gender perspective, to increasingly try to make salient the fact that gender considerations are core to good social protection design. So how do you design, for example, more social protection assistance benefits that are paid directly to women and that are paid directly in a way that women can access the benefits and they don't lose the money? So whether it is through financial inclusion, through direct payments, expanding the cash plus components, which is basically cash plus complementary measures that target women in order to get a more effective use of those resources and more resilience, and expanding and closing gender gaps in social insurance, so gender pension gap and comprehensive parental leave. So when possible, we are now trying to pay benefits to women digitally and seize the opportunity to close gender gaps in that process. So by providing IDs, by providing mobile phones, by providing bank accounts, by building financial and digital literacy, and by connecting women to training and services. So, and it's not only about basically paying the benefits to women by improving the opportunity that they can use these benefits to build assets and use those assets more productively. So they can not only increase their income or the well-being of their households, but they can increase their bargaining power inside the household and can influence how cash is spent. And they can demonstrate that basically their managing resources is important for the household, not only individually. And programs are doing this through messaging, labeling, or expanding access to markets and others. The plus component is basically shifting the idea towards like not only cash, but the cash for something and building greater gender equality and building skills in the process. So we've learned that, for example, engaging men to ensure that women have support to take up opportunities for entrepreneurship outside the home, where they can put some of this money for it, is successful for economic inclusion programs. We know that programs where couples are trained are more likely to get women into the systems. So if we equip women with better interpersonal skills, teamwork, and others, they're more likely to reduce gender disparities in labor market. And the other things that we've been doing is tackling probably care burdens more systematically. So not only as a stand-on for children or a stand-on for the elderly, but overall across other programs, whether it is public works programs, whether it is through Entrepreneurship Plus Care and others. And we have several examples to addressing this issue, say, for example, in Bangladesh and others. And the final area that probably deserves more attention that we're starting to work on is adaptive social protection to respond to climate change. So social protection policies and programs are extremely powerful for climate adaptation and mitigation. They can help build resilience and in livelihoods and encourage savings, and to basically be, as you were saying earlier, not only reactive but preventative of shocks. So the transition from shock to a better status is faster and less painful for the households. So social protection can basically promote mitigation activities through climate smart public works, and others can leverage women into these processes, which they're normally not called for to participate, but can also help people manage the impacts, such as sort of climate policies with job transitions, carbon intensive industries, and others. So tailoring this to women's needs is a necessary precondition to building climate resilience. And many of the things that we're trying to do through adaptive social protection is the integration of a gender angle, whether it's on disaster risk management, climate change adaptation, or social protection as a tool for disaster prevention. I think that was my time.
Yes, exactly, right on time. Thank you so much.
No problem.
And here we would need your help coordinating with your sister organization, because you raised the issue of the fiscal space, and the IMF has really the work of the IMF has been detrimental to the fiscal space in the global south, particularly because of austerity, because of the chronic debt that it is causing, and because of very bad credit risk management practices. And the social spending floors aren't being adequate enough, and have their problems as well. And we do need your help here, because despite, like, the World Bank has its strategy, gender strategy that you mentioned, the IMF has also its strategy, but at the same time, we can see that the spending on programs and services targeting women is alarmingly negligible in the global south, and it's only representing less than 0.01% of overall social expenditures. So this is something that we would definitely appreciate your help on. And let's move. And let's move to our next speaker in the Hope segment before we move to the last segment. But now in the Hope segment, let's move to our next speaker, who's Tara. Tara, please, I know you have much more to tell us about from Ethiopia, from Haiti, from so many contexts as to how much, leeway we have in making things better and basically implementing the recommendations and the reforms that we always talk about. So the floor is yours.
Thanks, Farah. I would like to speak about the importance of indigenous and community-driven mechanisms in providing social protection services to vulnerable groups. In all the three contexts, Ethiopia, Burkina Faso, and Haiti, our research shows that the indigenous community-driven mechanisms and collectives play a very significant role in providing social protection services to vulnerable groups, especially when there is a crisis. If we look at, I would like to share what one key informant from Ethiopia shared with us, that in their particular context in South Ari, there is a rich culture of mutual support and commitment, particularly in facilitating conditions to maintain and restore houses burnt during conflicts and destroyed by disasters. Our research shows that both formal systems of social protection provision and indigenous approaches are currently necessary. Although we all know that a language of rights is applicable only to the formal systems of social protection. It was interesting for us to note that the community voices viewed the indigenous collectives which provide social protection services as being guided by an ethics of care. And what was interesting for us was to note the tension in these indigenous collectives. Feminist leaders pointed out to us that the indigenous collectives are gendered collectives. For example, we see that traditionally the leadership in these collectives is held by men. So the feminist leaders pointed out to the importance of gender mainstreaming the indigenous collectives. What gives us hope is the effort made by women's organizations in Ethiopia, which are trying to address the lack of gender mainstreaming in both government structures and indigenous collectives. When I talk about government structures, the women leaders in Ethiopia shared with us that the disaster risk management structures at various levels are not gender sensitive. So what they shared was there is a need for gender sensitivity and greater gender responsiveness in both the formal social protection mechanisms as well as the indigenous social protection mechanisms. I would like to share one reflection question with which the research team has been grappling with. At one level, we are recognizing the important role played by indigenous social protection mechanisms. A question before us is, in which way can the indigenous social protection mechanisms be supported by various organizations without being extractive? If you put a decolonial praxis framework to answer this question, this part about are we able to support the indigenous social protection mechanisms in such a way that we do not become extractive, is that possible and how can that be done? This is a question for which right now we don't have answers, but we do think that it is important for us as a collective to think through and reflect more on the various ways in which the indigenous mechanisms and collectives can be supported because they play such a significant roles in the lives of communities. Yeah.
Sarah, this is so enlightening, and decolonizing the approach and leaving more room for the community-led initiatives, especially the indigenous initiatives, is definitely something that we're hearing. Probably I myself, like I'm hearing it as a new aspect that should be put in the forefront and should be put center stage in the hope, basically, segment of our general thinking about the topic. So thank you so much for that. I'd like to hear now more from Jane about her experience in the Kibera slum and how you think we could improve things, and for women, the situation of women, how this can yield some positive outcomes on social cohesion and on the overall living environment in the slum. Especially for, you've spoken in your previous intervention about the intersectionalities with other kinds of vulnerability. So being poor and being a woman, being a refugee and being a woman, and so on and so forth, is definitely should be taken into consideration. And we usually speak about mainstreaming gender, but gender often falls through the cracks. So perhaps if we look at things from a bottom-up approach and we see what's happening on the ground, we can be more gender aware in the policies that we are devising. So Jane, please, over to you.
Yeah, thank you once again, Ms. Farah. So what I can say is that already there's a lot of organizing on the ground. Women and girls are organized for various reasons. And if the governments or even development partners can work with these organized groups, then we can for sure be able to measure the change that is impacted in the community. In our organization, already we are doing a lot of work around providing pads and even detergents for the schools, for kids in schools to be able to clean their toilets. We say the woman's place is in the, a woman, like when you really want to share something, then you retreat to the toilet is a safe space for the woman. But most of the public toilets are always very dirty. So definitely we organize and give detergents to these girls to be able to clean their toilets so that when they go back and ask themselves, when they retreat, then they're retreating in a safe space. We have people who have organized themselves around, we call it merry-go-round, where people put money together and give to one person. The communities are already getting ways of putting money together and organizing their lives. And so our prayer is that if the government or the different actors working with communities can build into the already organized groups, then it can really be good. Like we are talking about the cash transfers, the mapping is always done mostly by people who don't stay in the community. So you find that there are people who are left behind and people who are not supposed to be left behind. But if there can be coordination where the communities are the ones who are presenting to the government that, you know, or maybe the development partners, that these are the people we have and this is how they are organizing their lives, then the real need for the people would be catered for. We have the National Hospital Insurance Fund in Kenya, which is very complicated as well because they cater more, they take good care of the civil servant and not just the common people as much as people are contributing. So if we can have all these platforms for the conversations where we are able to understand what is happening with the people and what they are already doing, so that we are not starting, we are actually building, strengthening, bettering what the communities are already doing, then I'm sure we would be really be having a lot of progress. As an organization, okay, as I mentioned before, I started Young as a girls empowerment organization, which has right now been taken over by the girls. And I'm so proud of that I've been able to pass this baton. But where does that believe me? I'm not organizing with women. I'm a widow. I'm organizing with the widow. So the spirit of organizing is still within me. And what now am I doing with the widow? When it gets to being a woman, then you want a decent place to live. Then you want to look at your own health and health insurance and other opportunities like that. So if the governments can be able to listen to the people and just plan and implement with the people, then the people would be celebrating, you know, even in the house, if you're able to plan with your children, they know when there is no money and they know when there is money, they know when they demand and they are not able to get whatever they need because there are conversations that are there. But if these are just ideas that are foreign, not planned with the people, not, you know, filling the gaps that have already been identified by the people, then it really doesn't work much. So that is what I can say. At least development partners work with us, not on us, plan with us, build on whatever we're already doing. You know, let's celebrate the successes together and let's also plan for the gaps that are yet to be filled together. Thank you.
Thank you very much. And maybe later we can explore in the Q&A if you think it would be a good idea to institutionalize these forms of solidarity and informal forms of resistance that are taking place. Brilliant. So we have, for the Hope segment, our last speaker for now for the Hope segment, who's Abiodun. Abiodun, over to you. Perhaps you'd like to reflect on the Child Development Grant or any other dimension or work that you've done and how things can be improved.
Yes, thank you. So for us, we in Nigeria, the ACF implemented the Child Development Grant in Jigawa State, one of the states with the worst malnutrition and stunting rates. And in different phases, about 50,000 women, pregnant and lactating women, were supported with monthly cash transfer, nutrition education, and behavioral change. So what we did was, of course, the project was not going to last forever. We advocated for a transition where the government could fund this initiative. And how did we go about this? We generated evidence and sustained advocacy through CSO's partners and through the implement other IPs that were in the project. At first, we faced, of course, resistance for there is no budget. Government keeps complaining, and there was a day we had to invite the deputy governor of the state to a stabilization center, and he saw a malnourished child, and he wept. And that was a turnaround. And while the program was winding up, the state governor made a commitment to begin to sustain social protection programs that focuses on girls and women. They have so far spent close to $1 million for this initiative, supporting monthly cash transfer for pregnant and lactating women. So women are now better equipped with at least monthly income that helps them to take care of themselves and their family. Another initiative that we promoted was advocating for free education up to the tertiary level for girls in Jigawa State, which was also even passed into law. We've also supported the state with the social protection policies that incorporate all these programs. And in 2022, they passed the social protection laws. The state legislature passed this into law. So basically, there is still a lot to be done. Just recently, we are working with the government to develop the old age non-contributory pension, which the government wants to fund. In all this, we see hope and commitment from government that they can really support with the budgets that they have to support women and girls and even vulnerable persons with disability in initiatives that can help give them a better life. In other states, we've tried similar things, but we are still facing some current challenges. So it's not success story in all the places. Usually, issue of budget and commitments to the plight of women and girls have not really reached all the nooks and crannies of all the states in Nigeria. So it's a gradual process. It's something we are doing. Even at the national level, we've also been advocating for inclusion of and government funding other social protection and social inclusion programs that are in these national social protection policies, not just the cash transfer. So we're advocating for universal universal health coverage for both formal and informal, for even very poor persons, for everybody to be able to access that. While we are at all this, we also have the need to continue to push for government commitment to raise funds, like someone mentioned about the fiscal space, also to see other funding opportunities that government could have to support social protection programs in their state, which is very, very key to sustainability. So because government budget alone from allocations from IGR alone is not enough to fund all the programs and of course all the development projects that they have and recurrent expenditure and all that. So we recently also conducted a fiscal space analysis for 4 states in Nigeria, which give recommendations to some of the areas where funding can come for government to fund social protection programs. Thank you.
Thank you, Abiodun, and thank you so much. And I'm conscious of time and the fact that I took a lot of time trying to offset for Shaha's absence. So we've got now the action segment, which is very important, but if you can keep it to 1 to 2 minutes max per speaker, just to tell us about the key recommendations and action steps that we should be taking next to basically incorporate or materialize these opportunities that we've got in fact or in reality. So Anna, would you please?
Sure. So in 1 minute, so I think I've said it. First, data. We need better data. That we always will need more data, and we actually need to work with data systems. Second, in a context of fiscal constraint, reducing inefficiencies in the systems, improving the system quality and the system ability to spend better, and reducing administrative costs. The third, social insurance for women across the life cycle. So gender gaps in pensions, support for women during the reproductive years, support for girls to transition from education to labor markets or to stay in education, and others. Expanding social care services, irrespective of women's work status, not solely for the women that are working, or with the idea that care services for children or the elderly are for women, support women working. And finally, continuing to strive for productive economic inclusion, bringing women's voices on how this can be done better, and bringing or creating better adaptive social protection systems to respond to shocks and crises.
Thank you. That was very succinct and on point. Jane, over to you.
Yeah, thank you so much. I would like to appeal to partners in the room to support people's academies and assemblies so that they can understand their right to social protection, what it entails, and the actions they can take to lobby for just a universal social protection. When they know they own and they can demand from their leaders and just hold their leaders accountable to their commitments. So we need to kindly support local organizing, that is academies and assemblies within communities. Thank you.
Thank you. Localization is key indeed. Tara.
Thanks, Vera. I have a recommendation for in terms of research. We feel that research, especially in fragile and conflict-prone areas, research and social protection needs a greater commitment with gender justice. We need a greater understanding about the gender-specific vulnerabilities which are playing out in fragile and conflict-prone areas, and the corresponding social protection needs which are needed in fragile and conflict-prone areas. So that is something which we feel is important. And a second point, the importance of supporting climate finance, recognizing the importance of climate finance in social protection. We think that it is a moral imperative and also a strategic approach. And we earlier spoke about the multidimensional poverty faced by women in fragile and conflict-prone areas. So we feel that greater support to climate funds can help governments to integrate and mainstream climate risk into social protection policies and programs.
Thank you very much. Thank you very much. Abiodun, following on from your eliminating interventions.
Yes, I think the belief generally in Nigeria is universal social protection is not possible, it's expensive, but I think there's a gradual process where this can be done. I would like to appeal for all stakeholders to involve the state governments more, the World Bank and ILO and all other partners to streamline this down to the state government. Because from experience, I realized the federal government can only do too much. So the state government have better way to reach, understand the needs of women and girls. Digital delivery system is also very important in the case of Nigeria to reduce corruption in the system and promote equality. And lastly, we need to advocate more for universal benefits for women and girls. These are more vulnerable groups that face more challenges than any other group. So we need to advocate for universal benefit across the life cycle for women and girls. Thank you.
I second, and thank you so very much. Now we've got like 12 more minutes for a Q&A, and I'm sure the audience has a lot to ask you, and you've got much to add as well. So please leave your comments and questions in the Q&A chat box, and we make sure to answer them. And perhaps in the meantime, I'll give everyone some time to process and digest what has been said and see what questions they would like to select, basically, to ask to our esteemed speakers. If you don't get any questions, I'll just ask some myself, or see if the speakers have any last thoughts, last messages to give, so that they can feel free to come in and do so. Okay, so we've got a question to Anna. I'm gonna read it out, and Anna, please feel free to answer it. Would you, from a gender perspective, encourage countries to invest in individual population registries, ID systems, rather than in systems based on households such as PMT and social registries? Anna.
Sure, happy to answer. I think we need to, so let me put it this way. A gender perspective is not always an individual perspective. So while we need information at the individual level, people live in households. So we need to try to understand how to better get information of possible individual challenges or deprivations that happen at the household level. So what we are recommending is to invest in ID systems so everybody can be identified, to invest better in administrative data so we know about everybody. And that when we do, whether it is social registries or other forms of identification of households, this identification includes the vulnerabilities of the different household members and their different needs. As much as we focus on children going to school or getting sufficient nutrition, we need to understand what happens with women. So this does not mean that a proxy means test algorithm that helps identify the households that you're going to benefit cannot include individual level indicators. And this does not mean that the social registry does not include individual level information. But for the most part, people live in households and there are certain necessities, needs that are better addressed at the household level. And there are decisions that are better taken at the household level and more than at the individual level. And we also need to respect the level of agency that needs to occur within the household. So it's no either or, is how we better get a comprehensive view of what happens with the household and the individuals in those households to better target social protection.
Okay, very clear. Any other questions from the audience? Any other questions, comments, insights? Okay, since none, so I'm gonna ask a question. I think, but I'm not sure. Yeah, I think Tara, Jane, maybe even Abdun can answer it mostly from their context. So unfortunately, we've seen, in addition to poverty targeting, poverty-targeted cash transfers and social safety nets in general, we're seeing also the definition of social protection to include active labor market programs, like Cash for Work, like SME and MSME incubators, and unfortunately, most importantly, microcredit programs and microfinance, all of which like induce chronic indebtedness amongst individuals and households, provide services that are supposed to be a right as a service, as an aid, basically, and do not meet their purpose. They're very tangential, and the Cash for Work has got its own problems. So have you had such experiences in the communities and the context that you where you live? And can you tell us more about, I suspect, the bad experience that you've seen with the implementation of such interventions instead of them being real policies or even programs? Over to whoever feels comfortable answering them. And if my question wasn't clear, I'm happy to repeat it. It's related to microfinance, to active labor market programs, being used as interventions, especially, by the way, to support women entrepreneurs, to give women microcredit to get some necessities to support their children education, for housing. And this is really it's being counterintuitive and against the purpose that it is meant for. But I'm sure I'm really interested to know if in Kenya, in Ethiopia, Haiti, if any of these programs have, and if you don't feel comfortable answering that, I'm fine. We can move to other questions.
Can I?
Of course, please do.
Yeah, I know in Kenya we have the local affirmative action funds, which still comes with conditions. And I also know that there are people, you know, we have not had enough information or awareness with the people. So mostly, and you know, this one, I hope most of you are aware of that, poor people are very scared of loans. Because they are not really sure how they can sustain their, you know, they can pay them back. Many people do the little business that they do to survive and not to develop. And still, if we are just, if the whatever loans are there, they're going to access these loans just to survive and not really develop themselves, then there is no sustainability. And I still go back to conversations with the people, like what really works for them, what kind of small businesses have they been doing that they can scale up to be something bigger that can sustain them and help them take care of their children. But we still have, you know, we can still have bursaries, we can still have free access to free education. Because we know the needs are so many, and that is why there are so many kids who are still not going to school, able to access quality education, because the school fees is too high for their parents. So I think if we are very genuine about social protection, universal access to social security, then I think we should talk about access to free education, you know, education without limitations. Thank you.
Absolutely, absolutely, because there is no social protection without a broader social policy, and this is super important. So thank you so much. Ending on this note is very important. Tara?
Yeah. I would like to share some examples of our other research studies in Burkina Faso and Sierra Leone. In Burkina Faso, what we see is, with respect to gender responsive budgeting, there are a lot of critical gaps in the entire process. And what our research shows that the budget making process is a political commitment about the government's priorities. And this entire in this entire commitment and intent of the government, the participation of women in the process itself is something which needs much more momentum. With respect to Sierra Leone, one of our research, which is on gender just macroeconomic policies, what we see is Sierra Leone government, in fact, they did downward revision of GST. The implication of this downward revision of the goods and services tax was that the more number of micro and small enterprises came into the GST tax bracket. And we all know that the micro and small enterprises are enterprises which are, many women are there in this particular sector. And when this entire process of how do women get affected by GST, how does it affect their profits, these were things which were challenges which were being faced by the women entrepreneurs. And our study in Sierra Leone also shows that for women entrepreneurs, especially from the micro and small enterprises, to take a loan is a very challenging process. The criteria for collateral, the amount of paperwork which is required, it is so humongous and it is so challenging for a woman entrepreneur to get to complete that particular process. So, our research is not yet complete, but what we are seeing is in terms of when we talk about macroeconomic policies, and if we analyze them with the lens of are they gender just, there seem to be a lot of gaps and a lot of work needs to be done in this particular area. This is a preliminary finding which is coming from our research. Yeah.
Thank you so much for sharing that. And when you mentioned the gender responsive budgeting, I thought to add to that we do need social audits and especially gender audits as well in our fiscal spheres in general, working spheres, I mean, in the fiscal system. We definitely need these, and we're missing these in the global south. Abudun, I saw that you wanted to come in. Please feel free to come in.
All right, just to say that in Jigawa State, where we implement the CDGP project, they have moved, like I said earlier, for free education for girls from primary down to the tertiary level. There's a CSO platform trying to carry out an assessment to see the impact, how many girls have been enrolled due to the free nature of the schools and all that. Now, for loans or in terms of microcredits scheme or income generating activity for women, That has not been sustained because, of course, generally it's the same in Nigeria. People are scared of loans. People don't want to take loans. Women prefer to do their small businesses and just survive. However, there is a push now for transition of the maternal cash transition of these women into livelihood support, but which has not been budgeted for. But we are on the track in pushing for it for the government to budget for it and to move on with it.
Yes, thank you so very much. I just saw a question that was added. I'm gonna read it out. I know that we're over, like the time is over technically, but we can take 5 more minutes to answer the question so that nobody is like turned down. So in some countries, there are issues of corruption which affect the implementation of social protection programs. How can these leakages be addressed, and what are some of the ways in which government can source for funding to finance social protection programs in middle-income countries? So I think the first part of the question is mostly about the discrepancy between the macro level, say the legislations, and the implementation level. And definitely we have a huge divide here. And the second is on financing. So whoever feels comfortable answering that, please do come in.
Yeah, okay, let me go. I mentioned earlier there's huge corruption in the system, and that is because the system has been designed in such a way that accountability measures are not strengthened. Recently, you may have heard in the news suspension of some very high-level persons who are in charge of some of these programs. You see, the issue of corruption in the system it cannot be overemphasized. Money being diverted, fictitious data being collected, and money diverted into personal pockets are some of the norms that. And how can this be solved? One, at the national level, we are working to digitalize payment system. That has to be done. It's being pushed for seriously, especially now that these new issues keep coming up. And another thing is the reliability of data. So recently, the Central Bank of Nigeria, the EFCC, have been saying that all Nigerians' digital payment system has to be linked to the national identity number. So these are mechanisms that can help. Although rural communities are constrained, but we can help in gradual formats to support them for this and have them register on this platform so that it can be traced. When money is sent to someone, it can be traced that this money actually gets to the person, no matter how many thousand kilometers the person or the woman or the beneficiary is. So that is one part. On the financing, yes, it's a huge gap because government also keeps complaining that they cannot finance all these programs, and that is where they need the fiscal space to see what other means, other sources of income, other sources of revenue that are available for government that can now be earmarked, that can now be budgeted for social protection intervention. And then again, it can be done in phases and not just all at once, which may not be possible at the initial stage due to the budget constraint. Thank you.
Thank you so much. Yes, digitalization and delivery mechanisms have a lot to do with the efficacy on the ground. And on the question of financing, alternatives are so many. There are so many alternatives to the reliance on foreign funds, basically, which are not debt-free. There are tax reforms, debt restructuring, climate finance can be an opportunity, fiscal decentralization can make an opportunity. There are so many solutions that, whether monetary or fiscal, that can be done, even relying on contributory schemes which are self-financed. So there are so many solutions and alternatives to the current development financing paradigm that we are living, and that unfortunately has got its downsides, a lot of downsides. We have a question to Anna, but Anna had to leave because we went over time, and she has we went past the allocated time, and she has another meeting. So the question says, Anna said that social protection programs need to be made more effective Is not the move towards universalism and removing administration a good way to do that? I can definitely guarantee you that it is the way. And we hope that this will be the way, basically. So, and on this note, universalism is the way. And we know that things are not possible with a click of, it's not possible overnight. It's a process. Social protection is a process. It's not a commodity. So we know that things need time, and that the realization of universalism has to be progressive for it to be feasible. But instead, for example, of spending a pool of money on a safety net, let's spend it on a national allowance. And this is how we can slowly but surely build up the universal scheme that we aim for. I would like now to end this great and very rich discussion. And I would like to really thank the speakers for joining us, to thank my colleagues, our partners in the Global Coalition for Social Protection Floors. I named some of the partners who are part of this campaign. There are many others that I didn't name, including Oxfam, including Development Pathways, but also would like to thank ACT Church of Sweden for leading on that, and all the partners in this convening today. It was very rich. We will be posting the recording on our social media platforms, on the website. I think that will be posted on the platforms of ACT Church of Sweden. So please, if you missed part of the discussion or all of it, you can get back to that. And let's work all together for more just systems, for more equitable social protection systems, and more gender transformative systems, for sure. Thank you all for joining. Bye-bye.
Thank you. Bye-bye.
Bye.